Right, good evening everyone. Welcome to Kellogg College, and it's lovely to see you all here on a pretty chilly night. My name's David Howard. I'm one of the directors of the Global Centre on Healthcare and Urbanisation, and we're delighted to welcome you to one of our public seminars, which I think have been running for about 6 years now, and we have 6 a year. They are once every 2 months, which is the start of end of university term, if that means anything to you there. And also, there's a format every year. It's always on every seminar. It's always on a Wednesday. It's always at 5 o'clock, and there's tea and coffee to start. We have a discussion at 5:30, and then at 6:30 is refreshments and hopefully vol-au-vents tonight. But we'll see how that goes. So hopefully the point is it's informal, and we invite 4 speakers to answer a provocative question in a 5-minute pithy pitch, and then really we hand over the work to the audience to raise questions and issues. So I hope hopefully it'll be an engaging evening, and we have an engaging topic tonight to talk about COP28. So welcome all. I'll introduce the speakers shortly, but I'll just give you some of the formats of the public seminars. We're really keen to have a discussion going and to do something slightly different, and we're trying to choose issues and topics that are relevant at local level, but also relevant at national and global levels. So if you have a topic that you'd like to be discussed at one of these seminars, do come talk to me, email the centre. There's our colleagues here, Astrid, Juliet, and Hannah, and Carl. But if you want a topic discussed, do come and let us know, and we will do our very best to deliver. If you email tomorrow and say, we really need a seminar on COP28, I have to say we probably won't do that. But COP29 in Dubai might be an issue to go for. So we will discuss today COP28 and COP overall. So COP is the Conference of Parties. It's part of the United Nations Framework on Climate Change, first established in 1995. Yes, that's right. And I think it probably came to prominence in 2015 in the Paris Agreement, when it was the first global treaty to engage with or confront really climate change. And that was around the global agreement amongst states to aim to reduce the increase in climate change to well below 2 degrees above pre-industrial societies, but 1.5 degrees became almost a numeric iconic number, shall we say, that I think has entered into, if not mainstream, that much of media and popular knowledge. So we're delighted today to have 4 speakers who are going to pitch your ideas and your opinion and expertise really about what COP28 means for us today. And we're interested to think about what COP28 means for you as a citizen, as a resident, as an employee or employer. And we're also interested in terms of how these act out at local, national and global levels. So I'm delighted today to introduce our 4 speakers, and I will shut up soon and get our speakers up to the platform to pitch their opinions. Here today we have Professor Isabel Oliver, who's the Director of Science and Research at the UK Health and Security Agency. Very welcome to have you here, Isabel. We have Dr. Rosie Rowe, who is the head of Shaping Healthy Places here in Oxfordshire, in the Oxfordshire County Council. We have Paul Skinner, who is the co-chair and company secretary of Rose Hill and Iffley Low Carbon Group. And we have Cassie Sutherland, who's the managing director of Climate Solutions Networks at C40 Cities. So I'm sure in their talks they'll talk a bit about their work and their experience, but we're really here to answer the question, what does COP28 mean for us individually, collectively, and I guess in the global level. So over to you, Isabel.
Thank you very much. Well, good afternoon or evening, everyone. It's a pleasure to be here with you today. The UK Health Security Agency that I work for protects health against infectious diseases and environmental hazards. That's not just chemicals and radiation, but also extreme weather events and natural disasters. Climate change, in my experience, it's often been considered as one in a long list of threats to health that we face, but in fact, it's not one in a long list of threats. It is the context in which we are going to have to protect health from all those other threats. it is a driver of the risk of infectious diseases and environmental hazards. And as you know, we are already feeling the health effects of climate change. So you know that we in this country have observed increased deaths as a result of heat waves. We know that flooding, such as the one we've experienced very recently, has very significant effects on mental health and well-being. And we know that in countries as close as France, we are seeing a really worrying spread of diseases carried by mosquitoes, such as dengue. So in this context, climate change is a priority for us in the UK Health Security Agency, and about a year ago I established a new Centre for Climate and Health Security to help ensure that we protect health as best as possible in the context of a changing climate. I attended COP28 as part of the UK government delegation. This was a new experience for me, although my teams had supported previous COP meetings. I had never attended one. It was an interesting experience. The reason why I attended is, if you are not aware, this was the first time when there was a dedicated day at COP on health. So we contributed to the program, contributed to a series of events, and the reason why I felt it was important for me to attend is that it was an opportunity to help increase awareness and the profile of health in the context of the negotiations that happen at COP. And, whatever we think about it, in some ways is the place to be because of, all of the key decision makers are there at that point in time. So one of the things that happened at COP this year is that for the first time there was a declaration signed on climate and health. That was, from our perspective, really good news. It was endorsed on the day, on the 3rd of December, yes, by 123 global leaders. And it in effect sounded the alarm on the very severe effects that climate change can have on our health, but it brought health into the negotiations in a way that it hadn't happened before. The declaration also expressed the need for urgency, for rapid action in terms of climate change, but also highlighting the benefits that deep, rapid and effective reduction in greenhouse emissions can have and will have on health. The signatories also committed to implementing a series of policies that maximize health gains from mitigation and adaptation actions, to reducing health inequalities, and they put this in the context of the terrible inequalities that we saw in the pandemic, and to protect mental health. So we all had high expectations from COP. This may seem a small progress to some. It was important for us in the health sector. There was also a declaration signed on food and climate, which made some commitments towards sustainable agriculture and resilient food systems. These are things that have not been perhaps covered that well in the press compared to obviously other parts of the negotiations. There was also, as you, I'm sure many of you will agree, there was perhaps disappointing progress towards phasing out fossil fuels. However, there were positive commitments made, for example, towards tripling renewable energy by 2030, for example. It is easy, in my experience, is it easy to feel discouraged and powerless when we talk about climate change. However, I think this is a bit of a personal opinion. It's not really necessarily a sort of policy position by UK Health Security Agency, but I think unless we communicate a more positive and empowering vision of the future, we will not get as much action as we need to get on climate, and certainly not on climate and health. At the time of COP, the UK Health Security Agency published the Health Effects of Climate Change report. Some of you may be aware of that. This report, the first one in 12 years, provides the state of the evidence on the health effects of climate change. The evidence shows that there is substantial and a growing body of evidence, so we know that climate change will have profound impacts on health and that it is already having those profound impacts, that they will be wide-ranging and that they will affect, they will not be distributed equally in the population. However, the report also highlights that many of these anticipated health effects are still avoidable through climate change mitigation or preventable through adaptation. So it's really important that we send a message that demonstrates that there's a lot we can do to protect health in the context of our changing climate. And it was great from my perspective to see that health focus at COP this year. Thanks.
Thank you very much indeed, Isabel. And we'll be a chance to ask questions and discuss ideas after our four speakers have pitched their ideas. Rosie, pleasure to invite you to the screen, but to the here.
To the here. Thanks very much, and thank you for inviting me to spend a few minutes considering the relevance of COP and COPs to the work of local authorities. And I think I probably share similar concerns amongst the audience that COPs are rightly criticised for being far too slow in delivering meaningful action to address climate change. But on the positive side, they do provide an opportunity to galvanise action at a local level, for us at a county level, to ensure that we remain focused on addressing the climate emergency. There are many pressures, many issues, but climate needs to be right up there at the top of the agenda. And it also provides an opportunity to shine a spotlight on specific aspects of climate change. In the case of public health, for me, COP28 is hugely important to our work in local government. As Isabel was saying, it was the first COP where there was a climate and health declaration. And it really finally and very belatedly recognised that health needs to be centre stage in the call for climate action, not a footnote. Because the most compelling reason for taking climate action now is because it will benefit our health, and those benefits will be felt not in 5, 10, 20, 30 years, but they'll be felt immediately. So from my perspective, sitting in public health, that declaration is absolutely critical in supporting our local action. We know all of the failures around COPs, particularly the issues around fossil fuels. And I think as a result of that, what we do in local government is to use the opportunity of a COP to galvanise local action. Because we know that inaction at a global level is resulting in issues like 2023 being the hottest year on record. And we know from a health perspective that the impacts of climate change are being felt by our communities right now. Anyone who experienced the flooding in Oxford last couple of weeks will know very much about that. But those impacts will be felt unequally. They will add to the inequalities that we experience in this county. They will affect those who are most vulnerable, the old, the poor, those with health conditions, those already experiencing years of poor health and premature mortality because of health inequalities. So from a local authority perspective, which is trying to create a greener, fairer, healthier county, we're not waiting for leadership from COP to create ambitious climate commitments and meaningful action to address climate change. I'm really proud to say that Oxfordshire County Council committed to becoming carbon neutral by 2030, and we've recently gone through an assessment by Climate Emergency UK, and we've been identified as the best performing county council in the UK for tackling climate change. The climate action framework that not just the county council but all the local authorities in Oxfordshire signed up to in 2019 sets out very clear ambitions and commitments and targets, But importantly, it's backed up with detailed action plans that we've developed with Oxford University to achieve these pathways to net zero. And an example of that delivery is the fact that we've just launched one of the biggest fleets of electric buses in the UK outside London. 159 electric buses. Cost of the proposal and the work is 82.5 million. That's going to deliver meaningful improvement to air quality in our city. So the work I do in healthy place shaping really supports prevention and mitigation of climate change. We're focused on inequalities. We're focused on supporting local community action that supports health and well-being at a micro level and including at times of major weather events. We're about creating sustainable built environments where people are able to live in healthy homes in both summer and winter, where they have access to green spaces that are biodiverse, that promote connectivity to nature, but also provide urban cooling. And we're also working very closely with health partners to really support them to create a greener, healthier healthcare system, because our health system is a major emitter. The importance that we in public health place on addressing the climate change is demonstrated by the decision we took last year to make this year's Director of Public Health's annual report a call for action on climate change and health. But very few other local authorities have done that. And we're very grateful for the HEC report, which has come out, which is supporting our evidence base. We've had climate colleagues and health colleagues working really closely together to generate information on the impact of climate change in Oxfordshire and what is being done to address it and what more we need to do. It's going to be published in April, and it will be a really clear call for action for our local health care and local government partners to work together to address that. But it will also be a call for action at the national level, because we need that global and national action and commitment to really make a difference. So I'll leave you with the two calls that it's going to be making, which are so important. One is that in anything we're doing around climate action, policy, strategy, delivery plans, we need to consider and maximise the benefit to our health and well-being. Similarly, from a health perspective, all health actions, policies and strategies need to mitigate and prevent negative health impacts from our changing climate. And we're doing this because actions we take to improve climate health also immediately improve our health and the well-being of others. Thank you.
Many thanks, Rosie. So we've had Isabel talking about the UK national and sort of global level, and Rosie talking about Oxford County Council regional level. Now, Paul Skinner, pleasure to hear you speak about Rose Hill and Iffley Low Carbon Group.
I have a whizzy slide.
Oh, sorry.
How do I get the slide up
to you there? There we are.
I thought everybody would have whizzy slides, but forgive our ambitious strapline, but this is us. Thanks for the invitation this evening. First, a little bit of history. Rose Hill and Iffley Low Carbon was formed about nearly 12 years ago, and our first significant action was to successfully campaign for solar panels on the as then unbuilt community centre in Rose Hill. That happened, and as part of the learning for this new group that was set up then, we realised that there were kind of two important things we needed to be doing particularly. One was engaging with local residents and getting the local people on board and understanding what we're doing, but also working with groups beyond Rose Hill, within Rose Hill, but also beyond Rose Hill. And we have, over the last few years, worked with a whole range of very prestigious and clever groups who have sort of used us as their local focus, if you like. Now, you might think that these two aspects of our approach would relate to this question about the COP in different ways, especially when we think about how much we should expect individuals to be doing and taking responsibility for their actions, and how much responsibility ultimately lies at government level. So I'm kind of exploring that a little bit in this session now. Some of our campaigns are very local and low tech. To give you some examples, we've planted loads of trees, more than 800 trees and a community orchard, 30 fruit and nut trees. We've thermally imaged more than 200 buildings within our little locality and helped the householders to identify where they may be able to save money by reducing heat loss. We've helped the primary school to get solar panels on the roof, and we've worked with the school to integrate environmental teaching into the curriculum. We've provided free low-cost insulation materials for local residents, and we run a repair cafe every 2 months. When we run events and we get involved in not just our own events but other community events, we kind of try to engage with the locals, the local residents, and chat to them about climate crisis and what it means to them and what their understanding is. We're aware, of course, that many of our residents and the local people have lots of other issues and things that concern them, such as lack of finance, lack of time, other resources. They are very busy just keeping going, and they haven't got a lot of time for thinking about things like the COP and the environmental crisis. And in my experience, most people who we chat to don't really know what COP is about. It's something that really is very not part of their sort of thinking about what's going on and following the news and so on. So to move from that to our working with other organisations, we have done some work with lots of expert and highly motivated specialists, people like locally bioregional, the Low Carbon Hub and Oxford Brookes University. And we've done lots of quite high-tech stuff with them, which I think is important. And it means that Rosehill and Iffley have got sort of known within the field, and we've collected a lot of data about the local housing stock and so on. And that means that we have been able to set up or be part of a consortium now that is working at installing heat pumps in the local area. The consortium is led by Samsung, but we are the sort of public face of them, and we support them in getting into the community and communicating with the local people. The aim is to kind of normalise heat pumps as a way of heating residential houses, but also importantly to look at the effects of electrical heating being the dominant means of heating within an electrical substation area. So that we've selected 2 electrical substation areas and are offering very cheap heat pumps to the people in those areas. We launched in April last year. Since then, 11 heat pumps have been installed. 4 heat pump open days have been held where people can come and see them in action and talk to people who know about them. And 59 home surveys have done to see whether houses are suitable for heat pumps, and hopefully a lot of those will be, and the installations will roll out over this summer. And those sorts of projects often rely on big grants from government and so on, and so they are likely to be dependent on the government's understanding of and commitment to meeting the targets to reduce CO2 and greenhouse gas emissions. And I suppose the question for me is, will the COP agreement actually make a difference to government policies which generate those funds or help make those funds available? And to be honest, I don't think they're going to make a lot of difference. I'm not an expert in this field, but governments seem to set their own targets or none at will, often influenced by vested powerful interests and so on. And although there was the mention of transitioning away from fossil fuels, it was a rather weak statement in my view. And I think sadly the COP process, although I recognise it is an important worldwide forum for governments and so on to discuss things, I don't think it's going to make a lot of difference to what we do on a daily or monthly basis. So sorry to leave you with a rather negative view there. Thank you.
Thank you very much, Paul. In 15 minutes, we've zoomed in person, I should say, from COP28 in Dubai to Rosal in Italy. So thank you very much indeed. And I'm sure there's lots of questions lurking in the audience that will be leashed upon us. So, Cassie, Southern's here. She'll be talking to us from the perspective of C40 cities. So over to you.
Thanks very much, and there's always a pro and a con to going last in a set of 4 speakers. You've heard 3 fantastic speakers, and what else do I say, right? Apart from just to say, weren't they great, and agree with everything they were saying. But yeah, I'm Cassie, and I'm from C40 Cities, which is a global network of cities and mayors around the world. So it's a network of 96 of the world's largest cities, where those mayors have all committed to take the most ambitious amounts of climate action. So I'll try and bring a little bit of that global perspective to this as well, to add and hopefully complement some of the great speakers who've come before me. So I think, you know, as Paul just ended on there, really, this kind of key test of COP28, and I was also there in Dubai in December, was really whether it could reach this agreement around a transition away from fossil fuels, a phase out of fossil fuels. And I think all of us in the climate community went into COP28 with very little hope about that. A big need, knowing it was a big need, but not feeling particularly positive about it, with it being held in the UAE, with the COP president also being the chief exec of the national oil and gas company there in the UAE. And it hasn't achieved everything it needs to achieve. We know we need to transition away from fossil fuels faster. But I guess I have a tiny bit of hope with some of that language that ended up in the closing agreement, as there was a recognition of the direction of travel that was needed. And I think a particularly important point, if we look from this global perspective, is what the UN Secretary General Antonio Guterres was saying, which really was like, this is a dividing moment and line at COP to really phase away from fossil fuels. And that opened up this space for a real coalition to come together of cities, of mayors, of negotiators, millions of climate activists all around the world who really put pressure on this transition from fossil fuels. And it is the first time that we're seeing in this kind of global text an agreement around a transition away from fossil fuels. It's definitely not enough. Please don't take my tiny bit of hope as being enough. It's definitely not. And from C40, the mayors of our network are requiring a much quicker phase out of fossil fuels and demanding no more investment in fossil fuel projects around the world. So that's really where we need to get to. But I think there's a little bit of hope in that. I think in terms of where the COP process needs to go, maybe this resonates with my colleagues here on the panel as well. It needs to be much more about the action that's being taken and helping to influence and actually accelerate some of that action, rather than the kind of discussion about continuation of barriers and what could be done. So and from C40, we talk about the cities being the doers, not the delayers. And so we're really focused on that kind of action that cities are taking. And we see across these almost 100 cities in the C40 network that most of them are reducing their emissions faster than national governments. So that's like the data that tells me that city action is really worth focusing on, local action, like you've heard from many of my colleagues here, that really that is going to make a difference, and we're going to see that happening on the ground. So I believe we should have a much bigger focus on that local action. I did see at COP, and this is my 3rd COP that I've been to in my career, there was a much bigger recognition of the role of cities and other subnational states, regions, in the future of the COP process. And I think we need to see the kind of leaning into that, to really allowing that space to open up. One of the things that came out, we've heard a few initiatives today, was something called the CHAMP initiative which is like a really long acronym. It's something about Coalition of Multi-Level Partnerships. But anyway, the point of it is 71 countries have now agreed to include cities in the next round of their agreements, so their nationally determined contributions. What will that deliver? Well, it'll help the countries. If you include the ambitions of cities, of local governments, local authorities, it will increase the ambition of those countries. But importantly, alongside each of those nationally determined contributions is an investment plan. And so what it should do by including the subnational leadership, the city actions, is get more money to those actions. So it should mean that governments therefore dedicate more money to city actions, to local actions. So I think probably won't see that till 2025, COP30, which is going to be in Belém in Brazil. But that's going to be, I think, a landmark moment for really freeing up some of the resourcing and funding that we've talked about is really needed today. So I think that was one recognition, and kind of cities were very present in that, which was interesting. And we also saw, so C40 is truly global network, 50% of our member cities from the global south, 50% from the global north. And for global south cities that have really been experiencing increased impacts of climate change, incredibly high temperatures, sea level rise, lots and lots of flooding, this release of funds towards addressing loss and damage, so the damage they have already faced from climate change, was very welcomed by them. Millions, billions of dollars being committed towards that, which is vital. So I think that was one area of the fossil fuels. I think it was also interesting, as been mentioned, around the Health Day. And at C40, we're putting a lot of emphasis on this importance of health being an entry point to climate action. I think, Rosie, you took this kind of stance as well of that importance of putting health at the forefront. And I think that applies. You can still talk about the importance of health when phasing out of fossil fuels as well. We did some research in C40 to say that the health impacts of fossil fuel gas plants are as bad as the health impacts related to coal plants, which wasn't necessarily understood so much before. The burning of coal was quite visible. People thought gas was cleaner. But we saw something like 35,000 premature deaths across these 100 cities in 2020 related to fossil gas plants. So quite an interesting number. And really looking out to 2050, you could reduce a number of premature deaths, around 800,000 premature deaths across C40 cities by 2050 if you really phased out gas. Saving, of course, as well, trillions of dollars of savings for healthcare systems, for social care, and so on. So I think that's really important in terms of that health aspect as well. And then maybe to leave on a maybe slightly more positive note before we get into questions, I always think hopefully something I can bring as representing these global cities is a few examples of what cities around the world are doing, which are hopefully interesting and maybe inspire you to do something similar as well, or tell somebody else to do something similar. So maybe to give a couple of examples, the city of Phoenix in Arizona is like one of the hottest cities in the world. It's getting hotter and hotter. And so one of the things they're doing there is really implementing a load of cool pavements, which is basically a coating you put on pavements, very light colour, reflects a lot of the sunlight, and therefore reduces the temperature of those streets and the surrounding areas. And this cool pavement has led to streets being around 5 to 6 degrees cooler at the hottest part of the day than they were without this coating. If you think of like 40 degrees, that's quite, 35 feels a lot better than 40, right? So I think, you start to actually think about yourself there in that position, it's quite significant. And they've put this over 70 miles of pavement in Phoenix. It's not actually that expensive, it's quite easy to install. So I think a really interesting example from Phoenix. Paul mentioned some of the work you've done in tree planting as well, in Rose Hill and Ifley. And we're also seeing that across a number of cities at C40, one of which is the city of Freetown in Sierra Leone, which does have a great name for their tree planting programme, which is Freetown, the Tree Town, and a good name is half the battle sometimes. And they have planted over 500,000 trees, and they've monitored each of them and kind of put a community ambassador together with each tree. And that member of the community then monitors the growth, the health of that tree. And it's led to this huge increase in the survival rate of those trees being planted, which of course is good value for money and means that you're getting the benefits of those trees for longer. So a great example, I think. Freetown, the Tree Town. And maybe just to end, Rosie talked before about great electric buses deployment that we've seen in the county. And another great example of electric bus deployment is in the city of Bogota in Colombia, which globally has the largest electric bus fleet outside of China. So loads and loads of electric buses. They've really invested in it. And it's great to see that. Good for air quality, great for reducing carbon emissions. But also Bogota have attached a training programme for women in the city. So high unemployment rates within women in the city, male-dominated traditionally sector, the transport sector. And so they've been training up female drivers, particularly for this new electric bus fleet, and providing a load of other kind of social care, helping with childcare, helping with some other sort of housing costs, to be able to enable a female-dominated workforce in these electric buses. So I hope that was vaguely interesting, not too repetitive with my colleagues, and look forward to the discussion.
Thank you very much, Cassie, and thank you all four of you for really giving us excellent sort of start to the discussion. So we'll hand over to the audience. Astrid is on the microphone, so if you have any questions, and for the panel, there's a microphone there if you want to answer in situ, or you can come to the podium. So if you have questions for individual speakers or the panel as a whole, it's let's go, as we say. Yes, the question over there, sir.
Oh, hi. I was just interested in this notion of hope that often gets cited and how important it is for addressing the climate crisis. And I just wanted to sort of question whether we actually knew that to be true, or if there might even be an argument that it isn't helpful to have hope, and a better motivator is to see less hope, in that you might lull you into sense of false security, move you away from adaptation, make you think that somebody else is going to solve the problem, or maybe even when you're citing the importance of hope, you're actually indicating why you're saying that, because actually you're saying so much of us do feel hopeless. So that's why you need to cite it, and you're just emphasising that. So it's just really a question to the panel about, how valuable is it to talk about hope, and who is it who really needs to be doing the hoping if we're going to get this thing done?
So who would like to start with hope or the lack of? There we are. I think you mentioned that, didn't you, Isabel, when you were at the COP? Yeah.
I did, and clearly, in my role as chief scientist of a scientific organization, I can't say that I'm speaking with a great body of evidence. However, I think there is evidence that the impact on mental health and well-being, particularly on young people, of feeling very discouraged about the future, and climate being a major driver of that. That's there's a growing body of evidence of that. I think it's probably also true that if we don't feel there's anything we can achieve about something, if we feel there's no, we're much less likely to take action. And the fact is that there is also a very significant body of evidence that a lot of the certainly speaking from a health perspective, but a lot of the health effects that we can expect to see obviously have not been realized yet, and they still can be prevented. So unless we communicate that message, then we are going to see very little action. Clearly, a lot of those adverse events, as I mentioned earlier, adverse impacts, are completely avoidable through mitigation. Not completely, are largely avoidable through mitigation. Even if we took the most radical action today to reduce greenhouse emissions, we would still see warming up until mid-century. That's what our health effects of climate change report showed. So mitigation on its own is not sufficient already, so we do need to think about how we take action to adapt. And we know that there is much we can do to make sure that our communities are more resilient, and that is why, and it's been very well highlighted this evening, action at local authority level and at local level and at community level is critical. But I'm sure there isn't a perfect body of evidence to, particularly on the effect of hope, not that I know of anyway.
So I think there, as Isabel was saying, climate anxiety is a real phenomenon, particularly amongst younger people. And if you always have a sort of a deficits conversation. So rather than talking about what are the assets in our communities and amongst individuals to tackle any problem, be it climate crisis or cost of living crisis, it feeds into that anxiety and sense of inability to influence one's own area of action, and that will cause problems in terms of mental health and physical poor health. So purely from a health perspective, it's really important to talk about hope, but there's also a rationale for it as well, because we know there are many things, many assets in our communities that we can build on to address climate action. There are things that we can do at an individual level, but there are lots of things that we can be doing at a systems level that can really impact and reduce the impacts of climate action. So calling for hope is based on evidence that there are things that can be done to address climate change, and in a way, being hopeful is also the engine of innovation and encouraging us to behave differently and to change how we work. And that's important if we're going to convince people to behave differently for our climate.
Thank you. The idea of hope and optimism is an interesting one. I hope you didn't think from my talk that we're all doom and gloom in Rose Hill and Italy Low Carbon. We're not. That was my view of the COP. We are all volunteers in the Rose Hill and Italy Low Carbon group. We do it because we want it to make a difference. We hope it makes a difference, and we hope that people can do whatever small changes they need to do at a local level, or if they can do more significant things, they can do that. We have to be optimistic, otherwise we'd all give up and go home and not do anything, really.
And maybe the hope for me comes from the solution, and the change looks pretty good, right? If we have cities that have all electric public transport around them, more public transport provision, more cycling, more walking, fewer cars, better access to services, clean air and heat pumps that heat our homes to a good level so they're not too cold in the winter and too hot in the summer, and lower cases of asthma because of reduced air pollution. And this all looks pretty good to me. And so that's my hope, is that change can be and should be possible. We're seeing good examples of it. And the end game is nice.
Thank you there. So utopia is edging out dystopia at the moment. That's good to go. There was a question at the back. Yeah.
Yeah, I'd like to follow on slightly from that. We hear a lot about communication, and we've heard the word change used an awful lot. And all the opinion polls show that most people in Britain are concerned about climate. But it also seems, and the message gets put out by the right-wing media a lot, that people don't actually want to change. And that message seems to be being reinforced in the media, the social media, where an awful lot of people now get their news, that the solutions simply aren't working, whether it's the dangers of electric bikes or whatever. And that misinformation is being pumped out by many of the same agencies that have been pumping out misinformation about vaccines, COVID, and so on. We appear to be getting a pretty systematic anti-change message. And I'm wondering if anyone in public health who've been struggling with that for a few years now would be interested to think, how do we tackle misinformation on climate change? Are there lessons from what we've learnt on tackling misinformation about vaccination and so on?
Shall I start with that? So I agree with you that communication is a real challenge, and particularly addressing social media communication channels is very difficult, but it is vital. And I think there are some interesting parallels to be drawn, not just in terms of addressing queries and concerns around around vaccination, but also the campaigns around smoking. I remember when people used to think that smoking cigarettes was good for you. There are parallels in other parts of public health that we can and must draw on. But I actually come back to my original point, is that we haven't talked about the importance of climate action to health. It's not even part of the narrative at the moment. And I think it will make a difference if we're really clear with people about what changes are needed and how it will benefit people's health now. It all feels all rather distant, talking about targets for 2040, 2050. But if we can say that actually this is going to improve the health of your child's asthma, if it's going to impact on your physical activity levels, so that you're much less likely to get coronary heart disease or to develop cancer, then actually that starts making a difference. But we have to be really consistent, and we have to identify trusted messengers. One of the reasons why vaccination levels were low amongst some of our communities with Black and Asian minority ethnic groups was because there weren't communicators from within those communities. So we've got to get much smarter about identifying trusted messengers, people like who are based in their neighbourhoods, who can really challenge those myths and bust some of those other narratives from social media. And I'd be interested to hear your experience locally on that.
Can I think about that for a minute? I don't know if anybody...
Yeah,
yes.
So I've had the sort of personal experience of having to do media interviews, for example, in the context of heat waves, and trying to convey the message that actually, if you take some simple measures, you can significantly reduce the adverse health effects of heat on the body. But you often get an interesting debate with, with journalists who think, well, isn't this, common sense, is this a nanny state and so on. But, physically, if you cool the body, you don't get the adverse health effects. And if people don't know what they need to do to cool the body, then, they'll end up in A&E and, So it's an interesting, it's difficult. But this is one of the things that we need to do better as public health professionals is develop, generally better communication skills. I think one of the problems with climate goes back to this, often negative narrative rather than conveying a more positive vision of the future, which is we're often telling people the things that they shouldn't do, and we're always communicating on things that in effect feel like a loss rather than a gain. We are not communicating that you can gain a better city or a better environment, that there is actually a better future out there. And certainly it's interesting to see that the debate around what's been described as co-benefits, but the sort of positive health gain as a result, for example, of mitigation measures, is only something that's fairly recently being discussed, and that's we haven't played that game very well. I think it's a bit we could have done better. So I think there are lessons for public health professionals and others to learn from this. But it goes back to the fact that there is no reason why we could not be communicating a much more positive vision of the future that people want to engage with and that people want to help make a reality.
Thank you. I think what has struck a chord with me is that actually a lot of our work has been, in terms of what you might call about health and other issues, has been to help improve the housing stock, because at the moment there's still a lot of houses which are actually very cold in the winter or very expensive to heat. So at the moment it's probably more about helping people to have a cosy home, which is therefore going to be more healthy for them. The social media issue is interesting, isn't it? I mean, we are engaged in this heat pump project, and lots of people seem to have all these unfounded beliefs about what's wrong with the heat pump, it won't work, or you need to completely change all your radiators. I mean, there are lots of myths about heat pumps that we are trying to dispel in our heat pump project. I don't actually follow all that stuff on social media. I've got other things to do, so I'm not a good person to talk about social media in that respect.
Thank you very much. I know Isabel and your team be very busy this week with cold weather alerts, which is you have a busy moment as ever. Yes, there's a question. There's a question at the back, I think, first, and then we'll move to the front.
Hello. This is a question, a practical question for Rosie specifically. I'm very proud that Kellogg has a partnership with East Oxford Primary School, which is, as well as being very diverse, 41 home languages, also serves one of those areas, one of those inner city areas where the inequality gap is so large that it doesn't qualify as one of the most deprived, in the category of most deprived areas of the country. We shall be judged by Ofsted later in the year, partly on our impact in the community. And I'm wondering, Rosie, whether I could come and talk to you and see whether our school, backed by the college, might be a helpful partner to have.
I'm sure there's time afterwards to discuss that with drinks as well.
I'd actually like to come and visit you rather than you come and visit me. So I pass my details. We'll connect up. I'd love to come and see you.
I'll come and see you immediately afterwards. Thank you very much.
There we are. Deal sealed. Is there a question? Yes, at the front here. So is that okay? There. Oh, right, yes. Okay.
Hello. I'm member of Hadnam and Tame, Hadnam Safe Walking and Cycling, and it's trying to link a small market town, 13,000, to Hadnam Station, which is effectively Thames Station, via a greenway, and 80% of it is in Bucks's domain, 20% in Oxfordshire's, and Buckinghamshire Council are playing a very long and slow game, and mainly holding the project up, and largely on the grounds of lack of finance. And it seems that the government have furthermore sliced the active travel fund from 200 million to 50 million in the last financial review statement budget. And so perhaps Bucks Council have a point. They have no money for it. So I ask the panel, is it not time to really demand a carbon tax and fee system so that the whole revenue problem is solved? Those who want to use a lot of carbon, which are mainly the higher socio-economic groups, will be paying significant amounts of money, and the poorer elements of society will, by dint of their using less carbon, will actually be better off. And this would be, it's been tried in British Columbia, and would this not be a powerful driver for the public to actually want to change their behaviour?
Thank you very much. So, carbon tax. Who would like to?
I think that it would be a very good idea, but I have no idea how you could implement it. But it sounds like a good idea. Yes. Somebody else might have an idea.
Oh gosh, I haven't got the answer, Paul. But no, I mean, I think a carbon tax is a super interesting approach and a framework that is starting to be tried in a few more areas. And I mean, I totally agree with the premise of how do we funnel more finance to climate action and climate solutions. And I think there's a set of mechanisms that can do that. I think a carbon tax is one. We've seen some great examples from other cities around the world where they've kind of implemented a carbon tax equivalent within a certain sector. So in Tokyo, for example, they've got this thing called a cap and trade scheme, which is for like the big commercial buildings in Tokyo. They're required to reduce their emissions over time, and they get taxed and fined if they don't. And the savings that they make initially, make a revolving fund. So they go to improving the energy efficiency and comfort of other low-income households. So that, for me, is a very nice mechanism that can happen within a city as well. In New York, they're introducing a similar type of requirement around large commercial real estate as well, also needing to reduce their emissions. So I think my worry with a carbon tax, I think the idea is good. I think it's good. It could take a long time to implement. I'm also interested in these kind of targeted areas where you could then ensure that some finance is flowing towards some of those measures that you're talking about. And in terms of walking and cycling infrastructure and ensuring that that's kind of being given some prominence, a number of cities around the world have put in good kind of longer term strategies for their municipal budgets as well. So how they've been able to make money from public transport and then put that into walking and cycling infrastructure too. And that's been quite effective in a number of cities.
So in terms of a particular tax on carbon, that's something for green financing experts to determine. What I do know in terms of delivering change on the ground is that we need some sustainability and consistency in funding. Programs start and then they tail off after a couple of years, or one particular grant scheme starts up and then there's a slightly different grant scheme with slightly different criteria. If you look at, for example, opportunities for funding retrofit of homes, it's a complete chaotic mess, really. And that means that it's very difficult from an economic perspective to encourage suppliers to stay in the market and provide, invest in the skills that's needed to do some of this sustainability work. And to be able to weather those hard times. So frankly, more funding, yes, but actually some sustainability and consistency in funding is as important.
I'm happy to move to another question. I mean, it's not my area of expertise, but I think there's no question that as we get closer to the target dates for net zero in various areas, carbon markets will become quite important. My concern, which perhaps hasn't been mentioned, is exactly the part of the rationale that you propose for a carbon tax, is that the better off obviously use more carbon. The problem is that they are also more likely to be able to pay the taxes, and whether that's we would not want something that has again a more disproportionate impact on people who might rely on certain type of modes of transport for work and things like that, which might be complicated. So I think we will have to explore those solutions, but they do require quite a lot of consideration, I think.
Thank you all. I think there was a question there. So I think it's time for two questions. If you're in the blue shirt, and I think in the white jumper. Sorry, behind you, sir. But I think there's plenty of time. There's so many questions, but I think there'll be lots of time afterwards to mingle and ask questions with the panelists and fellow audience members. But if we take two more questions, pithy questions and pithy answers, that would be lovely. Over to you.
So you mentioned healthcare maybe acting as a vehicle for more climate action. But I wanted to ask, what are the challenges that healthcare faces to decarbonize?
Okay. So actually in the UK, Greener NHS has done a lot of work, and in fact I think where globally ministers of health often have felt they could influence is around healthcare. So even at COP, in my experience, there was a lot of talk about decarbonization of healthcare systems. And I worry sometimes that the focus is a bit too much rather than the sort of wider determinants of health. However, I'm sure there's more we can do. I mean, I run a network of laboratories, among other things. They're very energy intensive. They are necessary for health security. You know, we're not where we need to be, so it's not easy. So there is certainly much more that we could do. But where I think there is an important driver, it goes back to the co-benefits argument, is that if we take action on mitigation and adaptation, we can very significantly reduce the burden on the NHS and other healthcare systems, and getting that message across more effectively will be very helpful.
I think as well as looking at innovation in how we deliver healthcare, thinking about sort of remote access to clinics, digitalisation, all of those initiatives to reduce the need for travel. We've got to remember how many people the NHS employs. I mean, it's something like 1.26 million people, and getting them to change their behaviours, encouraging them to think about how they travel to and from work, thinking about how not just the transport, but also thinking about their use of estates. That's a big population that could implement change. So it's not just about how the NHS delivers services, but as a major employer.
Thank you. So the final, just this there, that's okay for the finale.
Hi. I guess, well, some of my colleagues and I are currently in a teaching week about urbanization and the global south. And there was some reference to kind of more marginalized communities and loss and damage fund. I suppose my question off the back of challenges is, what do you see as some of the biggest opportunities for the global south and marginalized communities that occur at this nexus of healthcare and urbanization?
Yeah, thanks very much. I should out that that's Rebecca, who used to work at C40 as well, so thanks for the question. So I think it's a super important question, and there's huge opportunities in terms of not only, I think, the rapid urbanization of large parts of the global south. Some of our most expected to grow cities are expected to grow at the fastest rate are in the global south, so there's huge opportunities around ensuring the right infrastructure is in place for that growth. So we don't rush to fossil fuels as an answer, car-dominated urban areas, really baking in some of these things that are bad for health, some of the health aspects we've talked about, air pollution, lack of active mobility, and so really being able to use that opportunity in terms of growth to plan cities well, to plan these urban centres well. I think there's massive challenges. One of the things that I'm sure you and your colleagues will know better than me as well is around issues of informal settlements and marginalised communities in many global south countries and cities, and we're seeing an increase in those populations through climate migration as well. So a lot of people being displaced from their homes, more rural settings, due to flooding, due to high temperatures, due to disruption of land and supply issues and agriculture, and therefore moving to cities, to urban centres, and causing large amounts of informal settlements. I think this is a challenge and an opportunity. There is a big opportunity around economic opportunities for job creation, for new industries to come up, to be able to support increased populations in cities, but it's going to take a decent amount of time to transition. Maybe my colleagues have some examples of their more local examples to hear in Oxford.
I would just say that you wouldn't want to start where Oxford is now. That's the thing in terms of reducing car use and encouraging cycling and active transport.
But I do think that the need for climate justice is really important in the global north as the global south, and that's why some of our active travel schemes, for example, have been focused on connecting up some of our more disadvantaged wards with city centres, etc., because we need to address those barriers, and we're funding from public health some activation money, so that it's all very well building cycle lanes, but if you can't afford to have a bike or to have a helmet and a lock, you're not going to get the health benefits. So we're supporting that complementary work to enable people to get those health benefits as well as climate benefits. So we need climate action to address climate injustice in the UK as much as elsewhere.
Just a couple of additional things. So I think one thing is health can be the real sort of a real convener, a driver in not just in the global south, but very acutely in the global south, particularly as many countries sort of start to transition. So the problems with infectious diseases are growing, but they're also transitioning to a non-communicable disease kind of epidemiological pattern. But the other thing, going back to finishing on a positive note, I think there is much greater leadership coming from the global south than from, you know, some of the sort of traditional powers. And I'm very positive about, I'd like to really see what Brazil does with COP30. They were showing enormous leadership in Dubai, in my experience. The health minister was there, you know, involved in everything, really engaged. And, you know, I think, you know, I'm not sure about, you know, COP next year, but I think there is a real, you know, there was a lot of drive and engagement from Brazil, and it'd be really interesting to see what they can achieve.
Well, thank you very much, Dina. Thank you, especially the audience. I know there's quite a few questions that were unexpressed, but maybe can be answered over refreshments afterwards. So do come forward and have a chat. Thank you, all of you, for being here tonight. If you've enjoyed the seminar, it's been filmed, courtesy of universities. Thank you, University, for filming, and it will be on our website. So if you have friends who might be interested also, you can go online and look at the film then. If you are interested in proposing an idea around urban health, and we look at issues of urban health in a broad perspective, social, economic, environmental, then do get in contact and propose an idea, and we'll very gladly see if we can rustle up a seminar for you. And also next seminar, I should say, is on March the 6th, Wednesday, March 6th, 5 o'clock for tea and coffee, 5:30 for the start of discussion. Topics on roads to ruin, where we'll be discussing ideas, well, the practice and policy of transport. So that, again, should be a topical issue. I'd like to thank all my colleagues at Kellogg for making the evening run smoothly, and again, the colleagues from university as well for helping out. Thank the audience, but especially thank our four great speakers, Isabel, Rosie, Paul and Cassie, for providing an informative, entertaining and I hope interesting discussion for us all. So on that note, do make avail yourself of the refreshments at the back of the room, and let's applaud our speakers.